Viewer discretion advised. This video includes real footage of medical care. While it's not graphic, it may be sensitive for some viewers. Changing my grandson's colostomy bag at 7 months old. Real step-by-step care. This is the video we wish we had seen when our journey began. Real-life colostomy care for a baby. This is our everyday reality. If you've ever wondered what it really looks like to care for a baby with a colostomy bag, this is it. My grandson was 7 months old when I recorded this video. He was born at just 3 pounds, when the surgeon had to create 2 stomas to save his life. That procedure is called a double-barrel ostomy. This procedure involves splitting the large intestines into 2 separate ends of the bowel and bringing them to the surface of the abdomen, creating 2 openings on the outside of the skin. One stoma will drain waste, while the other will drain mucus. In this video, you'll see a real step-by-step change of his colostomy bag, the same way we've done it every day since he was discharged from the hospital at 5 pounds 8 ounces. We're showing this because so many families like ours are left searching for answers. What does the setup look like? How do you remove a baby's ostomy bag gently and safely? How do you clean the area? This is just one part of our day, but for us, it's become routine. For other families, just starting this journey. We hope this helps you feel less alone. If this video helped you better understand colostomy care, please like, share, or subscribe to follow our journey. Thank you. Viewer discretion is advised.
I knew it was time to change my grandson's colostomy bag when I noticed that some of his poop had leaked onto his t-shirt. Majority of the time, when I'm changing his ostomy bag, I'm by myself. When my daughter's changing it, she's by herself. And when you're doing it alone and you have an active 7-month-old, it can definitely take a lot longer. So one thing that we found that helps us save time is keeping him distracted. Whether it's feeding him a bottle, propping it up, or giving him his favorite toy, putting on one of his favorite shows, giving him a teething ring, or even rolling his arms up into his onesie. But every little trick helps. So right now, I'm using an adhesive remover pad, and I am wiping and loosening up and peeling off the colostomy bag slowly and gently. So I've finally removed the ostomy bag, and I'm tearing off another adhesive remover, and I'm going to wipe around his stoma again. And what I'm wiping is any poop or any sticky adhesive, any sticky residue that is still on his abdomen. You want to make sure you get it all off before placing a protective barrier. And sometimes you will go through, 3 or 4 adhesive remover pads. This was my first time using the neck camera, so sometimes the angle is going to be off a little bit. But once I realize that, I try to readjust myself. The protective barrier, it has discolored his skin. It's kind of like leaving a Band-Aid on for a long time. So what I'm placing on his stoma right now is just a gauze pad. And the reason why I'm placing this gauze on his stoma is just in case he decides to poop, it won't start squirting out. Now I'm getting ready to measure the size of his stoma and it's usually the same size, so I'm just going to trace it on the protective barrier. But when he was in the NICU unit, they did advise us that it's not a good practice to have a whole bunch of cutouts because the stoma can change. It can get smaller and it can get bigger. So we just kind of stuck to, you know, not doing that. And just every time we change his colostomy bag, we trace and cut. So that's what I'm doing right now. So I cut the center out. So now I'm getting the skin prep. And I'm going to wipe across his abdomen, the same place where I'm going to apply the protective barrier. And this is going to help the protective barrier to stick. I'm fanning to help it to dry. Okay, so right here I noticed that there was some residue that I did not get. So I'm going back over it with the adhesive remover pad. And then I'm going to reapply the skin prep, which is the one that's in the orange and green box. So I'm reapplying the skin prep because I essentially took it off when I noticed some residue, and I used the adhesive remover pad. So once again I'm fanning it to help it to dry faster. I dabbed it because there was a little poop coming out. So now I want to hurry up and get this protective barrier on in the colostomy bag before he starts pooping. So I gently cover, and it's a perfect fit. I'm just applying a little pressure to it, a little heat to it, so it'll stick better. Now I'm looking for the bag. His arms are coming out of the little roll that I made with his onesie. And he's finished his bottle, so now he's starting to get a little distracted. So I'm peeling the tape off of the colostomy bag. And the colostomy bag is going to go exactly on top of the protective barrier pad. It's not going to go on its skin. It's going to go directly on top of the circular protective barrier pad. So I have it on there, and I'm just applying a little pressure to make sure it's stuck. Now I'm getting these pads called Duoderm, and I'm going to place the Duoderm all around. I have two pieces. I'm going to place the Duoderm all around the colostomy bag and the protective barrier. And this is just extra protection if there's any leakage. And you have to make sure not to tape the colostomy bag because it needs space and room, and so you want to make sure that you get it on to the protective barrier. and the white part of the colostomy bag. That is what you're taping down with the dual derm. And this is just what we found that works for us. And we only use the dual derm on the stoma that the poop comes out of. We don't use it on the one to the right, the one that has the drainage for his mucus, because it's just not a lot. It's not a lot at all that comes out of the other stoma. But the poop stoma, we need all the support we can get. And this really, really reinforces it. So I have it all around. So I'm going to lift the edges up just to make sure that I did not tape the bag down. Here, I'm just checking both colostomy bags to make sure that the end caps are secured. If they're not, poop and discharge can easily leak out of them. And lastly, I am going to be throwing away all of the used materials and waste. And that concludes my video. Thank you for watching.